so just like before, we're going to go surgical guide, import CT scan, and then we're going to do this single central incisor case. So we're going to get our CBCT in here. We're going to just do the upper. I'm going to crop this one. Sometimes what I'll do is I'll rotate the occlusal plane flat. I'll look at the upper. I don't know. I'm just kind of a little picky. Our cone beam might, position the patient a little bit higher. Does it?
Yeah.
Is that what it does?
That's what I noticed.
Nice.
What does it say again? Making a flat occlusal plane.
So like,
Oh, yeah.
yeah, if you start by rotating the occlusal plane flat, he's saying that the panel looks a little better.
Doesn't that have a reverse smile line in the panel in the composite view?
Oh, got it. So I'm going to crop this one a little bit just for fun here. So we've rotated it, we've cropped it. All we're going to bring in is the maxillary portion of the CT. Okay, we're going to bring in the STL model. And let's see here. Okay. So I'm gonna make a clarification here. So here's our upper model for this patient. Here's our lower model. I'm going to control select, and I'm going to bring in both models at the same time. Yeah, that's a good question. So the first thing is it's going to say mandible or maxilla, and I brought in both of them. So which one is it asking me about? Over here you can see occlusion upper, so that tells me it's asking me about the upper, so we know it's a maxilla. It's going to do the automatic alignment for just the maxillary model. The other model it's not going to align. Now we didn't bring any of the lower cone beam data in, right? Only the upper cone beam data. Well, when you take a cone beam, you want the patient to be biting on cotton rolls. So they're in an open vertical in the cone beam, because the reason why is you want to see those cuss tips for stitching. If she's biting down and we scan her, it's really hard for the software to align because the cuss tips are blocked. So therefore, we actually want to align the lower model to the upper intraoral scan, not the cone beam, because otherwise it's an open bite, and then we can't really plan prosthetically. So first things first, let's change this to composite view, and then let's roll through our data and let's look. So here's dead center of a tooth. This scan should align very well. So as I'm rolling through here, I'm seeing perfect cuss tip alignment on everything. The reason being is because this patient has no crowns. It's all natural teeth. Software is going to get it 99% of the time. So this was automatically aligned. It's well aligned here. Now let's see, where's our lower? Our lower is like way off in space over here. So we don't want to align this lower to cone beam data. We want to align this lower to the upper intraoral scan. So how we do that is, in the model manipulation, we want to go and say, okay, we want to get the lower model, that's the blue one, and we want to align it to another model. So we click to model. And then it gives us a choice. Okay, which model do we want to align it to? Well, obviously the upper. And you don't want to align it to points, because points would be two models with the same features on it that you're trying to overlap via points. So you'd leave this unchecked. And then by doing this, it's going to snap your blue model into the bite that was taken with your intraoral scanner. So now you have the cone beam data aligned with the upper model, and then your lower model aligned with your upper model based on the intraoral scan. So this is how we'd want to set up this case, because we don't need the lower data, the lower cone beam data. And now if we go, we can turn off our cone beam because we don't need that. And now we see this is what the patient's occlusion looks like in the mouth. So not good. Very poor. But she comes in, she really, really wants an implant on number 9. You try talking to her about Invisalign or ortho or braces or whatever. You say, hey, your bite's super jacked up. And she's like, I get it, but I just really want an implant on number 9, so you do it. I would never do that, but I did on this patient. So
Don't do this, I do.
Don't do this, but I did it. But okay, I did kind of think through, okay, occlusion-wise, like how can I hopefully at least put an implant in where if she does go and try to get her bite straight, that she doesn't have to remove the implant. So making sure you have appropriate depth of your implant and make sure appropriate lingual inclination, where at least you're like, worst case is you'd have to use a custom abutment or something if she straightened her teeth. But at least she wouldn't need to remove it. So if we want to be truly prosthetically driven, we always start with putting a tooth in place first. Because if we jump in and just put an implant in, we're not thinking prosthetically. So let's think like prosthetically driven dentists, and let's add a tooth. So when you go and add a tooth, you've got a bunch of libraries here that you can choose from. These are all just built into Blue Sky. You can just look at the various libraries and figure out which ones you like. I like the last one. This is my go-to. It's called the Mitch Hurst library. It's just the one that I seem to gear towards. And then you got to click which tooth you want. We're doing tooth 9, so you're going to highlight tooth number 9. And then you're going to click OK, and it's going to give us that crosshair again. And again, this one actually, OK, you could click. But sometimes you have to shift click. If you ever like clicking, like why won't it put the tooth in there? It's because you have to hold shift. All right, so now we've got to put this tooth where we want it. And so now we've got arrows and we've got little nodules here. So the arrows move the tooth in a certain direction of the arrow. The nodules stretch the tooth in that direction. So essentially, you're just going to go and rotate this guy and try to get it lined up. I'm going to shrink it, slide it over, roll it around here. Okay, so I'm going to go out a little bit. All right, and then this needs to be shortened here. So you could sit here, you can make this as perfect as you want, but essentially you want to get it close because we're using this to plant our implant, but then we're also going to be using it to print a temporary for the patient. So get it as close as you can. This patient doesn't have a deep bite, right? She has kind of almost an open bite, which is actually really favorable for immediate implant loading. Deep bites, those are the ones you want to be careful. The deeper the bite, the less, you should push the immediate load cases. So look at that. All right, so I'm comfortable with that. There's probably a little bit of rotation here that could be done. All right, I think that looks fine. Now we have a tooth in position, and now we can go plant our implant. Actually, let's hide this is another view that you should look from here. All right. Might be a little bulky here. I'm going to shrink this down from the facial a little bit. So remember, the little nodules are for sizing. The arrows are for moving. Still looks a little thick here. All right. Okay, let's say we're good with that. Now we're going to go put an implant in. Now remember, our implant's not here up at the top. It's disappeared because we're in the model editing module. So to get that implant back, we got to go back into our advanced module, and now the implant reappears. So if I click it, I already know for this case, we're going to go with a 3.5 because she does not have a lot of bone. And then let's put a long implant in because we have a lot of apical bone. We just don't have a lot of width. So let's put a 13 millimeter. Now, when you get the crosshairs, you can click in a spot anywhere in these windows, but generally, like the pano window is pretty ideal. So just click the implant to get it started. And then we want to look at this window and this window to start with to get our position. So let's do this window to get the tooth what looks centered and looks like down the long axis of the neighboring roots, maybe. And then let's go back up to the cross sections, and then let's get this guy up here in the bone. Now, do you guys see the long axis, the line? You want to start shooting for the cingulum on that tooth. So this gives us a couple areas. This green outline is the soft tissue. So Dr. B pointed out that you wanted to be at least 4 millimeters below your soft tissue. So I could sit here and I could go and I could measure here to here being at least 4 millimeters. But you can also see the bone on the crest here just looks poor. So the poorer the bone that looks like in the crest, the deeper you might want to go. I would rather be deep enough rather than too shallow, because you can always compensate with depth with using a little bit of a longer abutment.
Especially on the anterior stuff, right?
Yeah, especially on the interiors. So even a 13 millimeter, you can see up here the nasal floor, we got plenty of room. It's not a big ridge, it's pretty thin. So this is going to be one of those where you're going to have to really start your pilot very carefully. You might want to flap this case, look at the crest, and poke a hole just to get that starter right in the middle of that ridge, because you can tell this bone is not very good. And you might consider just doing like a pilot to depth, and if it's soft bone, you might want to expand it a little bit with an osteotome. But we're not going to be using a thick implant here. It's just going to be like a thin 3.5. And if you have to choose, palatal or buccal, you want to be closer to the palate. The buccal is our bone that just seems to resorb all the time, really easily. So let's go. We've checked that one and this one. Let's look at this view. Now here, I feel like I need to go distal a little bit and maybe rotate it a little bit like that. And now I can start spinning along the axis of the tooth. Let's say I want to even go a little bit more here. So now I can start rolling it around and looking at it from all my different angles. So here I might even want to go a little bit more and angle it right there. So if I'm visualizing the long axis here coming out the cingulum, pretty ideal. But now as I'm rolling around, I'm getting a 360-degree view, and my implant's not leaving bone. It's just sitting in bone the whole time. You can scroll infinitely and just be able to visualize your implant. The last view is you can view it from this angle, and you can see your screw hole access and really get a nice clean view of where the screw hole would come. I might even want to bulk this out a little bit, but I like that position of the screw, right lingual to the crown. So you should be able to do a nice screw hole access for this. Okay. So our crown has been designed or placed. Our implant has been put in. Now what we want to do is we want to plan the guide tube. So let's turn the tooth off. Let's see. Hide the tooth. Let's look at our guide tube like before. Right away, we know we forgot to switch the fully guided kit. Now this is a good example of like narrow space, and check out how half our guide tube is submerged under the tissue. Here's a great, another great case for putting up to that 11 millimeter offset. But now I can see, okay, I like my guide tube now. I got plenty of space. It's right between the teeth. This should incorporate well. For the guide, for something like this, I would probably go canine to canine. So I'm just going to draw a line here. So I just did a quick outline, and then I can look at it and I can kind of visualize and drop these nodes a little bit. Just get a quick bulk, kind of outline of everything, and then roll it around, look at it. I'd probably just do canine to canine for a central, something like this. And then you hit create surgical guide. Now notice you want to do all of this before we're planning our temporary, because we're going to build the temporary now for this tooth. All right, so here's our guide. We can turn off our guide tube now. But here's our surgical guide ready to go. Now we talked about timing, so let's talk about that. Let's put an abutment on this. If we right-click this implant and I hit Add Abutment, we're going to put a tie base on this implant. So my tie base is this one, ABJHNP18. So this is my tie base right here. Now, when I look, if I were to turn off the green model, I can see my tie base right through my guide tube. Now, one of the things that's kind of nice is I still have the ability right now to rotate to spin my implant, and that's okay because I haven't designed a tooth yet on it. So if you see that little flat spot on there, some people say the flat spot's supposed to be on the buccal. So I could actually, at this point, spin that so it's straight buccal. Now what this allows you to do is if you didn't mark the timing, but you just wanted to know, like, hey, I want to know that I just need to put a flat spot straight buccal, you can actually do it at this phase, is actually put your marker flat buccal right there. So like as Dr. B was saying, is you could go in now and you could actually mark right here digitally on the guide and have an actual visualization. Or sometimes what we'll do is just after we print it, we'll just look at it and just take a Sharpie and just mark it right here. But rotate this flat to the buccal there. All right, so timing is set. Now we can put back on we can turn off of our guide and we can look at our implant, and now we can put our tooth back on. Now let's make this into a temporary. So what we're going to do is we got our abutment, our tooth. The only other thing we need to turn on is our opposing. So here's our opposing. Now notice her lower tooth is kind of kicked way out. We're going to have to account for that in the occlusion, and it's going to cut that away.